Hello all, this is Dr. Alsup, and it is the most wonderful time of the year, time to talk musculoskeletal anatomy. Now, as you've likely heard, and as you can kind of just observe, there is a lot of anatomy when discussing the musculoskeletal system. Think of how many bones, joints, and muscles there are in the body. Our discussions will be focused on the appendages, so the upper and the lower limbs, and we're going to start with the basics of the bones and joints of the upper limb. And there's a lot of material in this learning objective, as we are going to introduce all of the bones and the major joints of the upper limb. Do understand that we will discuss these in a bit more detail as we move through the week. So here I am really hoping to just get used to the terms, as in the names of the bones and the joints, and get a basic understanding of where these are located. Fortunately as well, the basic organization of the upper and lower limbs are similar, with the single bone in the true most proximal segment, two bones in the intermediate segment, and numerous smaller bones associated with the distalmost portion, so the wrist and the hand, as well as the ankle and the foot. But before we get started, I want to do a quick terminology quiz. Do you recall what the term proximal means? Hopefully you're landing on proximal means towards the trunk or point of origin, so hopefully that jogs your memory as to what distal means. Distal means away from the trunk or point of origin. We will be using these terms a lot throughout our MSK discussions, as in the proximal part of a bone, which is going to be the part that's closer to the trunk, or the distal portion of the bone, so away from the trunk. So we will begin with the proximal bones, which together are referred to as the pectoral girdle. And these bones serve to connect the trunk or the axial skeleton to the upper limb. So they're kind of in an intermediate place between the trunk and the upper limbs, but we're still going to mention them here. The clavicle, which is colloquially referred to as the collarbone, is located near the root of the neck. We saw it quite a bit when we were dissecting in this area. And it is firmly articulated with the trunk at the sternum, so at this sternoclavicular joint right here. It will also articulate with the acromion of the scapula, so that kind of lateral most extension, at the acromioclavicular or AC joint. Remember, you can palpate the clavicle for almost its entire length, and where it ends laterally means you are at the acromioclavicular joint. The scapula, sometimes referred to as the shoulder blade, will distally articulate with the head of the humerus to form the glenohumeral joint, more commonly referred to as the shoulder joint, which has the distinction of being the most freely movable joint in the body. Let's think a little more about the humerus. This is the only bone of the arm region, and it's also the longest bone of the upper limb. It is, as mentioned, will articulate with the scapula at the glenohumeral joint. And distally, it will articulate with both the radius as well as the ulna, or those forearm bones. So the humero-ulnar joint is typically considered the true elbow joint, but the humeroradial is within that same complex of the elbow joint, so closely associated with the elbow. Speaking of the radius and ulna, let's get to know them a little bit more. The ulna is going to be the more medial of the forearm bones and will play a big role in movements at the elbow joint. The radius is, so this is medial and this is lateral. So the radius is the more lateral of the forearm bones and will play a big role in terms of the wrist joint or the radiocarpal joint. In fact, the ulna does not articulate with the carpal bones at all. It doesn't quite reach that area. Its more proximal end is going to be its largest component. The radius and ulna will articulate with one another in three separate areas, so forming three separate radial-ulnar joints. There is the proximal radio-ulnar, as well as the distal radio-ulnar, these joints play a big role in terms of the actions pronation and supination. And there's also a joint that joins the shafts or the bodies of the radius and ulna at the interosseous membrane, so often referred to as the radio-ulnar syndesmosis, because this is actually an example of a fibrous joint. Now moving to the wrist and hand, and this is where the bone count and joint count really increases significantly. The carpal bones can also be thought of as the wrist bones, and these are examples of short bones. There are 8 carpal bones in all per hand. There is 4 in the proximal row. So this is the proximal. And 4 in the distal row of carpal bones. So that proximal row is going to articulate with the distal radius at the radiocarpal joint or wrist joint. All of these 3 right here, the pisiform actually doesn't articulate with the radius. This is an example of a pisiform, a sesamoid bone. One bone I do want you to be able to identify is the scaphoid, which is the lateralmost carpal bone in the proximal row. And the reason that we typically discuss the scaphoid is because it is the most frequently fractured carpal bone. And when fractured, due to its tenuous and retrograde blood flow, avascular necrosis is possible associated with this bone. Any joint, so any time that these bones articulate with one another, so a carpal bone with another carpal bone, those are referred to as intercarpal joints. So that will be kind of throughout this complex. The distal row of carpal bones will articulate with the metacarpals, which are these bones right here, or the bones in the general palm region, at the carpometacarpal or CMC joints. There are 5 metacarpals, and they are literally numbered with the first metacarpal being the lateral most. So make sure you're thinking in terms of anatomical position, with the palms facing forward or anteriorly. And so that first metacarpal is associated with the thumb, and we know the thumb is lateral in anatomical position. And then it moves in order from there with 2, 3, 4, and 5, 5 being associated with the 5th digit or the pinky finger. Distally, the metacarpals will articulate with the proximal phalanges at the metacarpophalangeal joints, which are a really long name, so very often you just see it abbreviated as the MP joints or the MCP joints. And now to everyone's favorite, the phalanges. These are the bones of the digits, and there are 3 rows of phalanges. You have the proximal phalanges, of which there are 5, the intermediate phalanges, of which there are only 4, so no intermediate phalange associated with the first digit. And then again, there are 5 distal phalanges. So these are by far the smallest of the phalanges. The joints between the proximal and the intermediate phalanges of digits 2 through 5 are referred to as the proximal interphalangeal or the PIP joints. And the joints between the intermediate phalanges and the distal phalanges are referred to as the distal interphalangeal or DIP joints. And since there is no intermediate phalange associated with the first digit, the joint between the proximal and the distal phalange is just referred to as the IP or the interphalangeal joint. Excellent. So we have already reviewed all of the bones and major joints of the upper limb. Not too shabby for the first learning objective in musculoskeletal anatomy. And hopefully you can use this handy dandy summary slide to refer back to and study. As mentioned, we will talk details about these bones and joints as we continue to explore musculoskeletal, but now we should at least be familiar with the names and general locations. So you can keep coming back to this slide just as kind of a point of review. All right. Thank you for your time and attention here. And as always, if you have any questions, please feel free to reach out to myself or any of my anatomy colleagues. Have a great day.